On April 11th, guidance was issued implementing legislative provisions specific to COVID-19 diagnostic testing and services from the FFCRA and the CARES Act. With the FFCRA Act passed, beginning on March 18, 2020, health plans are required to cover COVID-19 related diagnostic testing and related items and services providing during a medical visit with no cost sharing. No cost sharing means no deductibles, no co-payments, and no co-insurance. And this is for in and out of network providers. Also, plans cannot require prior authorization or other medical management requirements on such services. Meaning, if you have an HMO, you would not need to get authorization from your primary care physician prior to testing. On March 27th, 2020, the CARES Act was enacted, and with that came some amendments to the FFCRA Act. These amendments expanded the coverage of testing and diagnostics for COVID-19, and now also includes antibody testing, known as serological test, with no cost sharing. These tests are used to detect antibodies and are intended for the diagnosis of disease or previous infection. As mentioned above, related items and services must be covered with no cost sharing. This includes urgent care visits, emergency room visits, and in-person or telehealth visits to the doctor's office that result in an order for or administration of a COVID-19 test. Also, items and services furnished to an individual during visits that result in an order for or administration of a COVID-19 test must be covered, but only if the attending health provider has determined they are necessary for testing. The example given by the DOL and the HHS is if the individual's attending provider determines that other tests, for example, an influenza test or some sort of blood test, is required or should be performed during a visit, again, in-person or telehealth visit, to determine the need for COVID-19 diagnostic testing, and the visit results in an order for or administration of COVID-19 diagnostic testing, the related tests must be covered. This coverage must be provided with no cost sharing when medically appropriate for that individual. Please note that the treatment of COVID-19 is not addressed in either act. However, many insurance carriers have taken it upon themselves to cover treatment with no cost sharing. Be sure to visit your carrier's specific website or contact me for more information.